Welcome to the Pre-Admission and Resident Review or PASRR Overview training. The purpose of PASRR is to ensure that individuals with a qualifying XMI or ID-DDRC are evaluated to determine if they need services and support specific to their conditions beyond what the SNP can provide. PASRR is required under federal regulations at Title 42 of the Code of Federal Regulations, Section 483.100 through 483.138. Per the regulations, PASRR is required for anyone going to a Medicaid-certified skilled nursing facility, regardless of the individual insurance type or payment source. The PASRR process must be completed within an annual average of 7 to 9 working days. DSCS strives to complete it in 3 to 5 days. We, the Department of Healthcare Services, or DSCS, are here to support hospitals and Medicaid-certified nursing facilities with training, onboarding, and adjusting to new process. We use acronyms to identify programs and entities. First, DDS stands for Department of Developmental Services. They oversee the ID-DDRC process. DSCS is us, the Department of Healthcare Services. ESD stands for Exempt Hospital Discharge. GAT stands for General Acute Hospital. ID-DDRC stands for Intellectual Disability, Developmental Disability, or related conditions. PASRR stands for Pre-Admission Screening and Resident Review. SMI stands for Serious Mental Illness. SNP stands for Skilled Nursing Facility. Here we have the definition for some commonly used terms. A new admission is an individual who has never been admitted to the facility before or does not qualify for as a readmission. A readmission is when an individual who is already admitted to the SNP leaves temporarily to hospital for care and then return to the SNP to continue their care. An inter-facility transfer is when an individual transferred directly from one SNP to another, with or without an intervening hospital stay, without being fully discharged to home. A significant change of condition is any major decline or improvement in a resident's health status, and a PASRR or resident review needs to be done as status update. Exempt hospital discharge. The 30-day exempt hospital discharge, or EHD, is an exemption from the PASRR process. All 3 criteria must be met for the hospital to use the exemption. First, the individual is admitted or plans to be admitted to the SNP directly from a hospital. The individual requires SNP services for the same condition treated at the hospital. The third criterion is the attending physician certification. This can be a note, a letter, or an email, etc., as long as the document can be produced upon request in the future. We recommend keeping the certification in the patient's medical records. Next, the definition of serious mental illness, or XMI, refers to a diagnosed or suspected mental disorder that results in either functional limitation in daily life within the past 3 to 6 months or requires recent treatment within the past 2 years. The slide shows the full definition of SMI. This is the definition of the IDDDRC, which refers to lifelong conditions that start before an individual reaches adulthood and affect how a person thinks, learns, or functions in daily life and may require special services. Full definitions including examples of related conditions is shown in this slide. Level 1 screening. Level 1 screening is a process used to identify possible SMI or IDDDRC based on a resident's medical records and direct observation. There are two types of level 1 screenings. The initial screening or PASS, resident review or RR, PASRR responsibility or PASS. Hospitals are required to perform the PASS on any member planning on being discharged to a Medicaid certified SNF as a new admission. SNFs are required to perform the PASS only when a member is being admitted directly from the community. PASRR responsibilities for RR. Hospitals are not required to perform the RR since the member is not a resident of the hospital. SNFs are required to submit a level 1 screening as an RR only when there is a significant change in the member's physical or mental condition. To enroll in the PASRR system, please complete the Facility Approval Certification form and email it to pasrit@dscs.ca.gov. For detailed instructions, visit dscs.ca.gov/PASRR. PASRR system rules. There is no limit to the number of approvers or users per facility. Approval role can add, inactivate, and reactivate users and can initiate, accept, or decline PASRR file exchange from another facility in the PASRR system. User role can complete, view, and print PASRR screening and initiate PASRR file exchange. There are two different PASRR processes that run parallel to each other. Here is the first process known as the XMI process. It starts with the level 1 screening and is broken up into 3 parts. The first part is the facility's responsibility, and this is the submission of the level 1 screening. The second part is the contractor's responsibility, and this is the evaluation. And the third part is the DSCS responsibility, and this is the determination. At any point in the process, if the result is negative, then the PASRR process is completed and the case closed. For your information, over 60% of all screening in the system are closed as a level 1 screening. About 30% close with the contractor because an evaluation isn't needed, and 10% will go through the entire process and produce a determination. Here we have the IDDDRC process that runs parallel to the XMI process, and it starts with the same level 1 screening. If any question on section 2 of the screening is marked yes, then the IDDDRC process begins when the screening is submitted. At any point in the process, if the result is negative, then the IDDDRC process is completed. But instead of the DSCS contractor, the DDS will decide if an IDDDRC level 2 is needed. If a level 2 is needed, the regional center will conduct the evaluation, produce the PASRR summary report, and upload the report into the system for the facility. Level 2 evaluation. A level 2 evaluation is performed when the level 1 screening is positive for possible XMI or IDDDRC. The level 2 evaluations are done face-to-face or via telehealth when available to determine placement and specialized services. DSCS is responsible for XMI Level 2 evaluations as required by law must be performed by Accenture Health, a third-party contractor. The DDS is responsible for IDDDRC evaluations, which are performed by the regional centers. Determination. After the Level 2 evaluation is completed, a determination is provided. The XMI determinations will be available in the PASRR online system and will include placement and treatment recommendations for the individual. The IDDDRC determinations in the form of a PASRR summary report will be provided by DDS Regional Center and upload into the PASRR online system. The appeals process is available if the resident, facility, or conservator disagree with the Level 2 determination. A request for reconsideration can be submitted through the PASRR system within 90 days of the original determination. If the reconsideration outcome is still not what was expected, a state fair hearing can be requested through the Department of Social Services, CDSS. Contact information. For any PASRR inquiries or requests, please contact the California Department of Healthcare Services IT Service Desk via email or phone. You can reach the IT Service Desk by email at itservicedesk@dscs.ca.gov and be sure to include PASRR in the subject line or call 800-579-0874 and select option 2. Please provide your first and last name, contact number or email, and inform them that it is for PASRR. Support is available Monday through Friday from 7:30 a.m. to 5:50 p.m. Requests will not be processed after business hours, weekends, or on state holidays. DDS. For questions relating to ID DDRC Level 2 evaluations or determinations, please contact DDS via phone or fax. You can reach them by phone at 916-654-1954 or by fax at 916-654-3256. For questions related to Level 2 evaluation, please contact the GSCS contractor, Essential Health, directly via phone, fax, or email. Essential Health can be reached by phone at 888-201-0614, by fax at 844-523-6388, or by email at capasrr@essentia.com. And that concludes the PASRR Overview training. Thank you for attending.